Bravecto or NexGard. Choosing the right flea and tick pill for your dog can be a confusing decision. The single biggest difference? One pill from Bravecto protects your dog for 12 weeks. NexGard is a monthly treatment. But the monthly pill NexGard holds a powerful advantage. It's the only one FDA approved to prevent Lyme disease infections. Meanwhile, the long-lasting one, Bravecto, has a key safety approval for breeding or pregnant dogs that NexGard lacks. So how do you choose? We'll break down how they work, how fast they kill, and a major FDA warning to help you decide. First, what are they? Both Bravecto and NexGard are in the same advanced class of drugs called isoxazolines, using similar ingredients. They target the nervous system of fleas and ticks, causing hyperactivity, paralysis, and then death after they bite your dog. They sound powerful, so are they easy to get? The first step is the same for both. You need to get them from your vet or purchase them online. Both come as a chewable treat. NexGard is beef-flavored, while Bravecto is pork-flavored. What if your dog is picky? NexGard only comes as a chew. Bravecto offers chewable, topical, and even injectable options. What about the price? A single Bravecto chew costs more up front, but since it lasts 3 times as long, the monthly cost is very similar. Let's go deeper on that 12-week versus 4-week difference. Bravecto's major advantage is convenience. 1 dose for a whole season. This significantly reduces the chance of forgetting a dose and leaving your dog vulnerable to pests. On the other hand, NexGard's monthly dose gives some owners more control. You can time it with other monthly medications. So which one kills parasites faster? The answer is surprisingly complex, and as you'll see, it depends entirely on the pest. When it comes to fleas, Bravecto has the edge. It starts killing fleas within just 2 hours. NexGard starts in 6 to 8 hours. But for ticks, the story changes. Bravecto has extended 8-week protection against the tough Lone Star tick. Let's apply this. Imagine you have a new puppy. You can start NexGard on puppies as young as 8 weeks old. Bravecto is only approved for dogs 6 months and older, making NexGard the clear choice for very young dogs. Now, what if your dog is part of a breeding program? Here, the safety profiles become the deciding factor. Bravecto has been studied and approved as safe for breeding, pregnant, and lactating dogs. NexGard's safety has not been. Consider a dog who hikes where Lyme disease is a concern. Remember, NexGard is the only one FDA approved to prevent that infection. So the best pill isn't universal. It changes based on your dog's age, your lifestyle, and your geographical location. But there is one more critical piece of information that applies to both drugs. The FDA has issued a safety warning for this entire class. The warning highlights the potential for neurologic side effects, including muscle tremors, loss of coordination, and in rare cases, seizures. It is vital to understand these events are considered rare, but the risk is not zero. A talk with your vet is non-negotiable. Aside from that rare warning, the more common side effects for both drugs are very similar: vomiting, diarrhea, and lethargy. With all these factors, should you pick one and stick with it forever? Some vets suggest a more flexible approach to prevention. Let's connect the dots. If your dog has a rare reaction to the 12-week Bravecto, the drug is in their system for 3 months. NexGard's monthly dose means that if a problem arises, the drug clears their system much faster, offering a safety advantage. So which is faster? Bravecto is faster on fleas. But if your main fear is Lyme disease, NexGard's specific approval might be more important. Finally, to prevent parasites from developing resistance, some vets recommend rotating medications every year. Your best choice may change. Let's summarize. Choose Bravecto for long-lasting 12-week convenience, its approval for breeding dogs, and a faster initial flea kill. Choose NexGard for its FDA approval for preventing Lyme disease infections, its use in puppies as young as 8 weeks, and monthly control. As we've seen, there is no single winner. The best choice depends entirely on your dog's personal profile, age, health, and lifestyle. The most important step is using this information to have an informed conversation with your vet.